You never guess where we are. We're in a hospital, a community hospital here in Beijing, and we've just been shown around. We're here with China Radio International. They've been showing us around and showing us some of the things that they do in this hospital, and we've learned a lot.
Yeah, so what's kind of unique about this place is that previously in China there was no community healthcare. If people got sick, they went to a hospital and they were treated. And then one of the problems with that, if they went to a different hospital, because generally people in China move around a lot more than other countries. You know, they might work in Beijing and then they move to Shanghai. And so they go to then maybe a hospital in a different area, and that hospital wouldn't have their records. And it was all kind of healthcare that if you got ill they would treat you and it was sorted. But what this place has introduced is what's called community healthcare, where they, similar to sort of the UK, where you register with a doctor, and then that doctor looks after you and your family. That's what they've pioneered here, and this was the first one in Beijing. So this centre looks after about 90,000 people.
Whoa.
And they have a team of 15 doctors and a similar amount of nurses, maybe about 20 nurses here. And they basically monitor, when people register with them, they monitor people's health. You know, for older people they might monitor diabetes and high blood pressure. So they've turned it into more of a preventative healthcare. And the other thing that was explained to us is that during the COVID-19 period, which actually is still in, they played a big part in helping people like self-diagnose and quarantine. They trained community workers how to spot symptoms and things like that. And
do you have a short breath?
Not really.
Our question is not really. Do you have a low voice? You don't have the power to speak?
Not a problem.
Oh yeah, not a problem. Are you usually in a low emotion?
No, definitely not.
No. Are you easy to be nervous?
Not at all.
Okay, you are very healthy, I think.
You don't need. I've got some more, yeah.
You usually feel lonely?
No.
No.
Definitely not. Waiting for the diagnosis. So what's the verdict? Do I need to be admitted to hospital?
It says maybe it is easy for you to get allergic. Both your skin or other parts of your body. So maybe you should pay special attention to this part of thing. For other parts, you are a very healthy person.
Okay.
Yeah. You only need to pay attention to the allergic thing. Yeah.
Okay.
Yeah.
Right.
Okay.
But I knew that.
Yeah.
Yeah, you already knew that.
Yeah.
And then it tells you again.
Basically just pay attention to your health.
The other thing is that the data from all those 90,000 patients is anonymously stored as big data, so they can see trends and things of healthcare things happening, and then that will feed into like a bigger national system, so they can actually see patterns of issues.
And we've just been inside to have a look at how some of the cupping treatment is done. So we'll roll that now, because that's a very interesting little segment. What we're about to see just here is a very Chinese medicine as such, and basically what they do, I'm going to show you in a minute, is they put cups on your back or anywhere actually, and they use suction. So afterwards it produces these big red circles, bruises, and we're about to watch it be done right now, but I don't know why it's done, so I'm going to have to find that out.
They light a little fire in the cup.
Hold on.
Let's see.
Oh my god, it's burning.
Whoa.
没有，不会烫到
I've
你，
not seen it done
不
with
会烫
wood.
到你，放心。
Okay,
it's okay.
The fire burns inside the cup, so it sucks
Whoa.
in oxygen, but it sucks it in a long way, man.
बहुत मजा आ रहा है. I love it.
I just mentioned that this is really popular in China, and I've just been kind of corrected by my interpreter here, saying it's more popular among elder people. So this is obviously something that younger people are not so keen on. I don't know whether that's because it's painful, but I remember having a cupping done on the bottom of my foot, and that was really quite painful.
Well, what do they do it for?
It's to draw the blood to the surface, I believe.
Yeah. Your body ache, some part of your body aches, you can get this treatment, and then your body will feel better.
But when you see somebody who's had it done, it looks as if they've been in a boxing match, because it gets very bruised after, because it sucks your skin in quite far. These are wooden ones, so you can't see, but if you use the glass ones, you can see how far the skin gets sucked in. Yeah.
How does it feel now?
I feel very relieved.
Does it hurt now or not?
Actually, it helps to give you the less pain. Actually, when you put this kind of this pakwa, that time you may have pain, but later part it will really help you to relieve the pain. And I did it before, but not exactly like this, like the way they are doing here. I really enjoyed it.
Oh, cool!
I love it because it's good for back pain and all.
Well, I'll have to try it sometime.
Yeah.
I just want to mention one of the big differences between Chinese hospitals and hospitals in the UK is one thing is privacy. We were just talking about it as we go around. Chinese hospitals are not very private at all. They are kind of interesting. You can talk to the doctor and you can have plenty of other
people. 6 or 8 people like
next to you, and no matter how private the situation is, there's always going to be other people around that can hear you, and there's not that many private rooms, but you may be thinking, oh, that's horrible, blah blah blah, but the Chinese, because that's the norm for them, they don't seem bothered.
No, that's right.
Like, we just walked in, they asked us not to film in this section, but we just walked into a room where a guy was getting acupuncture, and there was about 4 people in there, and he was just using his phone. He didn't seem bothered in the slightest that about 6 foreigners are walking in, having a look at what they're getting up to.
Going on.
And it's just kind of an interesting thing, because in the UK, if you're in the hospital, you will have a private room, and
people will knock.
If people want to come in, you'll have to have the person's permission to go in and look. So it's just a difference there.
Something else interesting I've learned today is that they have this preventative healthcare here, and for a majority of younger people, there's a small fee to pay, and the majority of it is covered by their sort of social insurance. However, for people over 65, it's all given and dealt with completely free of charge for them. So what's it telling us?
Yes, and they ask our patients come here to take free body check. Yes.
Okay, so this message, this system, it stores all the numbers and things, and at the time they need to come in to have a check, it will send a voice message to their phone, so they know they have to come here to get the check.
And over 65s, was it? Get it free?
Yeah.
Yes, free.
Yeah, that's good.
Thank you for your help. You've been a great hospital guide. Bye.
Have a good day. Again, that's kind of similar to a sort of UK where pensioners, people on old age pension, will get that free treatment, you know.
Yeah, healthcare in China is something you have to, it's a pay-as-you-go thing, besides what you just said anyway.
Yeah.
However, compared to, somewhere like the US, it's extremely affordable. It's much cheaper anyway.
Yeah, and the other thing is that if let's say you go on Monday and you're diagnosed with something, you need some minor surgery, you can literally go and have that surgery within a few days.
The Chinese, they pay attention to their health. They're very, very health conscious. They've got a phrase that's 注意身体健康, and that's like, please pay attention to your health. You'll hear it a lot, like if you're working too much or something, or it's cold outside, people will say this phrase. Yeah, people will say this phrase. There's a big focus to pay attention to your health in China. Anyway, that's a little look around a hospital and a bit of information for you. I would like to get some comments down below from the Chinese people who we might be missing things. There might be some there might be some big differences between the Western and Chinese way of doing treatment and things that we're not aware of. So it'd be interesting to get your comments down below. If you have enjoyed this video, please do drop a like as well. It does help us more than you might realise. And stay tuned for more videos from Beijing. We will see you in the next one. For now, take care.
They've just come outside, and interestingly, we've seen this kind of room here. And what this is that in the COVID time, if somebody came to this hospital and was suspected of having COVID, they obviously didn't want to bring them inside the hospital because there was a risk of infecting other people. So this is kind of an isolation room where what would happen, the patient who's suspected of having COVID would go into one side of it, and then it was an isolated sort of barrier to the other side where they would then give them a test for coronavirus. And obviously if they had then coronavirus, they wouldn't be obviously allowed inside the main hospital.
So it's activated, it's opened using a foot sensor, so you don't have to actually use your hand and contaminate the handle.
Obviously if they tested coronavirus and they were okay, they didn't have coronavirus, they were then allowed to enter the hospital. And that's obviously like a portable unit, and that was used for that, which is a pretty cool idea really. So it's like a mobile.
I mean, you would hope to think that they were doing that all around the world, because to have someone during COVID with symptoms just walking into the hospital, it's probably not going to be the best idea.
And I've actually noticed this is built on a sort of shipping container dimensions, so they would be able to load this onto the back of a truck and just drop these units pretty much anywhere, connect up an electrical source. They got all the filtration in the top. So that is a really cool idea, man. That is really good idea, isn't it?